Is Washington prepared for an emergency? A new report on public health emergency preparedness finds that less than half of the United States considered highly prepared. And that report uses 10 public health indicators to give states benchmarks for progress and point out gaps in their hazard preparedness. Rhea Farberman with Trust for America's Health is live with us this morning to break down where Washington ranks on that report. Good morning to you.
Good morning.
So what were some of the key findings for our state in this year's report?
Well, as you say, Washington State is one of 19 states in our high performance category, so you're doing well. But even for states in the high category, there's room for improvement. In terms of what Washington is doing well, your public health funding increased for the years. That's important. You're accredited in both emergency management and public health. That's important. Your state laboratories have a surge plan in the case of, for instance, an infectious disease outbreak. This was important during the pandemic. They're able to surge capacity. So those are all things that help public health on a day-to-day basis and in response to an emergency.
I think it's good to hear that overall there is a good level of preparedness, but talk to me about what states can do to reduce the risk for communities that experience some disproportionate impact when it comes to this type of emergency.
Yeah, it's an important question because we know there's a connection between under-resourced communities and their level of risk during an emergency, their ability to weather an emergency and recover from an emergency. So if you have a community that's at historic disadvantage, maybe because of structural racism, they tend to have fewer resources for healthcare, less access to safe housing, less access to transportation. So during an emergency, have fewer resources that are needed during an emergency, are less able to recover from an emergency. So we need to invest in those things that help all communities, make sure that everyone has access to health care, access to transportation, jobs that pay a living wage. So everyone is healthier and more resilient during an emergency. We know emergencies are going to happen. We just don't know what they will be and when they will be, but we need to invest in being prepared now.
So as we have learned over the last 3 years, there are just so many things that impact communities when there is any kind of emergency that really impacts the entire community. But what are your recommendations to improve public health preparedness?
Well, the first and foremost recommendation is that we need to invest in public health. We need to have sustained and consistent funding for public health, both at the state and the federal level. During COVID, we saw a lot of monies targeted to public health. That was important, and it helped us move beyond the pandemic. But those were one-time dollars, and they were specifically earmarked for COVID. So a lot of departments are facing what they're calling a fiscal cliff. Those dollars are going to run out and they'll be back in a situation where they are underfunded. So we need the federal government to step up and invest in public health on a consistent basis. So state departments can plan. They can invest in data infrastructure resources, for example, and invest in the public health workforce.
Interesting and thoughtful points there. Really appreciate your time, Rhea.
Thank you.